I want to go across to Dr. SK Sarin, Director, Institute of Liver and Biliary Sciences. Appreciate, and someone who's advising the Delhi government at the moment on COVID. Appreciate your joining us, Dr. Sarin. I want to understand, is the Delhi government now under pressure? You're suddenly issuing notices to private and government labs suggesting that they are violating ICMR guidelines by testing asymptomatic patients. Is the reality that the fact as the numbers rise, the Delhi government is now also coming under pressure to keep testing down?
Thank you, Rajdeep. I don't think the Delhi government is in any way under pressure. I fully well know that. The government is well prepared. Even if 2,000 cases or 5,000 cases come, every day, even then the government is very well prepared. In fact, they are ahead of the thinking that 1,000 or 1,500 cases are coming.
No, so why then issue these notices? So why then issue these notices? Why issue the notices to an RML hospital or issue it to private labs? Are you telling me that even an RML is not giving accurate reports? Ram Manohar Lohia Government Hospital not giving accurate reports about COVID positive patients?
Well, thank you for having faith in government hospitals more, at least equal to private labs. I'm not saying, and I do not know the details about the RML and others, but this is a virology test, and it can be happening that sometimes you have a spillover and sometimes a false positive may come. So I'm not saying they are bad or others are good, but the reason that why should you be testing everybody asymptomatic? There were times when we were looking into the spread, we were trying to find out the spreaders, super spreaders. It's not the case now. We all know that a fair amount of virus has gone into the public. Our aim today should be that we protect lives. And for that, we should be seeing those who require admission come, they immediately get tested and get a bed. I'll just give you an idea. Delhi has close to 10,000 beds. There were about 9,000, so 800 private beds have been added. And the admissions were just about 4,000 or so. We have a number of ventilators, about 408 available ventilators, and about 250 patients were on. We have enough ventilators. Even if you get 5,000, I hope I'm wrong, but by the end of the week or next week, if you get 5,000, Delhi government is well prepared with the number of beds, number of ventilators or ICU facilities. What is most important and what Delhi government has exceptionally well done is to provide people with an oximeter. It's a simple device, all of you know that. It's a device with 1,000, 1,500. You put it on the nail bed and it gives you the oxygen saturation. You are staying at home. If you are at home, and through you I want to appeal to everybody in Delhi or across India that if you have an infection with corona, please stay at home. If you have no symptoms, mild symptoms, monitor your oxygen. If your oxygen goes below 94, 93, well, be a little careful. If it goes less than 90, you certainly need to be in the hospital. If you are diabetic, if you have any other comorbidities, and above the age of 55, 60, then you can even at an oxygen of 94 can go. So what Delhi government has done is to educate people to look after themselves and create enough capacity in ICUs, enough capacity in that. I don't think there is any panic there.
So you're saying,
in any form.
So you're telling
what
people,
also is clear is that
you're telling people don't go into private labs and get yourself tested, or don't encourage private labs to have you tested unless you have the symptoms. Am I correct? You want to follow the ICMR guidelines, because the fact is 80% of patients in the last week have been asymptomatic.
Yes. In fact, to give you the precise number, when we started and we had the Chinese data, we were thinking 20% of the people would require admission. I have precise numbers for last 15 days. 14% of the people require hospital. Just about 1.6% or so require ICU. About 0.3% require the ventilatory support. This is much lower than China, where 2.3% require a ventilation support. So if you look at it, the number of sicker patients are less. More is the burden of those who are having no symptoms or mild symptoms. And like any cough and cold and flu, we have to get over it. We have to see that you can stay at home, monitor your oxygen, fever, little bit, yeah, if it is above 102 or so, then you are in trouble.
Okay.
And as Sangeeta and others said, it is a war. When the country is at war, it's just not the soldiers who fight there. It's the whole community, the whole nation. The nation fights in the war. So we need not differentiate. It is private, it is government. There is need for one command, and I think that is what is a problem in Delhi. You have some central hospitals. You have some hospitals which are under government of Delhi. There should be one command. Like in New York, Cuomo, the governor, all 200 hospitals were under the governor. Why can't we have a central command just for a period of 2-3 months? All hospitals report to one Delhi government and they manage the thing so that there is no discrepancy.
Okay.
And I think that will be a way forward. The Delhi government has launched the Delhi Corona app. Everybody can go which hospital where. So everything is on the plate. So I think we should work together, like on one table, all hospitals.
Sure. You've given a valuable suggestion. You need a single command center, you believe, at a time like this, and especially in Delhi, that's been a problem. Thanks very much, Dr. Sarin, for joining us. Remember, in the next week, we'll be going to different states, not just Delhi and Mumbai. I assure you, over the next 10 days, we'll go to different states to check what the situation is when it comes to critical issues like testing.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.